Hello everyone, so this is Stuti and I am here to talk about NABH Standards Core Objective Elements. So you can also follow my Instagram account which is Healthcare for You Forever, and I will be talking about the core objective elements of the first 5 chapters. Okay, so let's get started with this particular presentation. Before we move on to the core objective elements of each and every chapter, let's find out that what are core elements. So certain objective elements in the standard have been designated as core objective elements. These are objective elements that the organization should have in place to ensure the quality of care and safety of people within the organization. Core has been used to identify such objective elements. So you can see core which is written in a different form, like there is a NABH logo instead of the O alphabet. So this kind of word is being used repetitively in the NABH standard book to make sure that each and every person who is reading that book is able to identify the core objective element. Okay, now let's move on to the next slide to talk about the objective elements of chapter number 1. So, chapter number 1 is access, assessment, and continuity of care. So, the first objective element is AAC 2B. That means this is the core objective element of the first chapter, access, assessment, and continuity of care, of the second standard with the B point or B core objective element. A unique identification number is generated at the end of registration. Now comes the second core objective element of the first chapter, that is AAC 4A. That means this is the objective element, core objective element of the first chapter, fourth standard, and A first core objective element, that initial assessment of outpatients, daycare inpatients, and emergency patients is done. Similarly, for the rest of the objective elements, that AAC 5A, that means first chapter, AAC, Access Assessment and Continuum of Care, fifth standard, A point. Patients are reassessed at appropriate intervals to determine their response to treatment and to plan further treatment or discharge. AAC 9A, imaging services comply with legal and other requirements. AAC 12D, the organization implements standardized handover communication during each staffing shift, between shifts, and during transfer between units and departments. So here you can see there's a difference. Rest of the uh, objective elements have A, B as their objective elements, and the last one has the D. That means the D point. AAC 12 standard, D point. Now let's move on to the next slide to talk about the objective core objective elements of chapter number 2, care of patients. So here you can see care of patients is the second chapter of NABH Standards 5th edition. First standard, B core objective element. The organization has a uniform process for identification of patients at minimum use two identifiers. COP2C, care of patients, second chapter, second standard, and C objective element. Emergency care is provided in consonance with statutory requirements and in accordance with the written guidance. COP8B, second chapter, 8th standard, B objective element. Transfusion of blood and blood components is done safely. COP13B, second chapter, 13th standard, B objective element. The pre-anesthesia assessment results in the formulation of anesthesia plan which is documented. COP13E, second chapter, 13th standard, E objective element. During anesthesia, monitoring includes regular recording of temperature, heart rate, cardiac rhythm, respiratory rate, blood pressure, oxygen saturation, and end tidal carbon dioxide. Now, there are more core objective elements of this particular chapter. This is a very long chapter of NABH Standards 5th edition. Now comes the COP 14D, second chapter, 14th standard, D objective element. Care is taken to prevent adverse events like wrong side, wrong patient, and wrong surgery. Second chapter, COP 15A, second chapter, 15th standard, A objective element. The organ transplant program shall be in consonance with the legal requirements and shall be conducted ethically. COP 15D, Second chapter, 15th standard, D objective element, the organization shall take measures to create awareness regarding organ donation. Care of patient, 16C, COP 16C. Second chapter, 16th standard, C objective element, the organization identifies and manages patients who are at risk of fall. COP 16D. Second chapter, 16th 16 standard, D objective element, the organization identifies and manages patients who are at risk of developing worsening of pressure ulcers. COP 16E. Second chapter, 16 standard, E objective element, the organization identifies and manages patients who are at risk of developing deep vein thrombosis. So these were the core objective elements of the second chapter. Now let's move on to the next slide to talk about the core objective elements of the third chapter. So third chapter is management of medications. So first is the MOM2A, third chapter, second standard, A objective element. A list of medications appropriate for the patients and as per the scope of the organization's clinical services is developed collaboratively by the multidisciplinary committee. MOM3A, third chapter, third standard, A objective element. Medications are stored in clean, safe, and secure environment and incorporating the manufacturer's recommendation. MOM3C, third chapter, third standard, C objective element. The organization defines a list of high risk medications. MOM3E, third chapter, third standard, E objective element. High risk medications include lookalike, sound-alike medications, and different concentration of the same medication are stored physically apart from each other. MOM3G, third chapter, third standard, G objective element. Emergency medications are available at all time and are replenished promptly when used. MOM4B, third chapter, fourth standard, B objective element. The organization adheres to the determined minimum requirements of prescription. Now let's talk about the rest of the core objective elements of the third chapter itself. MOM4E, third chapter, fourth standard, E objective element, implementation of verbal orders ensures safe medication management practices. MOM4H, third chapter, fourth standard, H objective element, reconciliation of medication occurs at transition points of patient care. Third chapter, sixth standard, D objective element, dispensed medications are labeled. Third chapter, sixth standard, E objective element, high risk medication orders are verified before dispensing. MOM7D, third chapter, seventh standard, D objective element, medication is verified from the medication order and physically inspected before administration. MOM7H, third chapter, 7 standard, H objective element, measures to avoid catheter and tubing misconnections during medication administration are implemented. Third chapter, 8 standard, C objective element, the organization captures near miss, medication error, and adverse drug reaction. Now let's move on to the core objective elements of the fourth chapter, that is patient rights and education. Okay. Now PRE1C, fourth chapter, first standard, C objective element. The organization protects patients and family rights. PRE1D, fourth chapter, first standard, D objective element. The organization has a mechanism to report a violation of patient and family rights. PRE1E, fourth chapter, first standard, E objective element. Violation of patient and family rights are monitored, analyzed, and corrective preventive action taken by the top leadership of the organization. PRE2D, which is fourth chapter, second standard, D objective element. Patient and family rights include treating patient information as confidential. PRE2G, fourth chapter, second standard, G objective element. Patient and family rights include informed consent before the transfusion of blood and blood components, anesthesia, surgery, and initiation of any research protocol and any other invasive high risk procedures treatment. PRE 3A, 4 chapter, 3rd standard, A objective element. The patient or the family members are explained about the proposed care, including the risk, alternatives, and benefits. Now let's talk about the rest of the core objective elements of the 4th chapter. PRE 4A, which is the fourth chapter, fourth standard, A objective element. The organization obtains informed consent from the patient or family for situations where informed consent is required. PRE4C. Fourth chapter, fourth standard, C objective element. Informed consent includes information regarding the procedure, its risk, benefits, alternatives, as to who will perform the procedure in language that they can understand. PRE4E. Fourth standard, fourth chapter, fourth standard, E objective element. Informed consent is taken by the person performing the procedure. PRE5A, fourth chapter, fifth standard, A objective element. Patient or family are educated in language and format that they can understand. PRE6A, then fourth chapter, sixth standard, A objective element. The patient or family members are made aware of the pricing policy in the different settings: outpatient, emergency, ICU, and inpatient. PRE7C, like fourth chapter, seventh standard, C objective element. Organization readdress the patient complaints as per the defined mechanism. Now let's talk about the fifth chapter, objective elements, hospital infection control. HIC 1A, fifth chapter, first standard, A objective element. The hospital infection prevention and control program is documented, which aims at preventing and reducing the risk of healthcare associated infections in hospital. HIC 2A, fifth chapter, second standard, A objective element. The management makes available resources required for infection control program. HIC do 2D, fifth chapter, second uh, standard D is the objective element. Adequate and appropriate facilities for hand hygiene in all patient care areas are accessible to healthcare providers. HIC 3A, fifth chapter, third standard, A objective element. The organization adheres to standard precautions at all times. HIC 3B, the organization adheres to hand hygiene guidelines. Third standard, B objective element. 3D, fifth chapter, third standard, D objective element. The organization adheres to safe infection and infusion practices. Now, the last core objective elements of the fifth chapter, HIC 4C, fifth chapter, fourth standard, C objective element. The organization adheres to housekeeping procedures. HIC 4D, for then the fifth chapter, fourth standard, D objective element. Biomedical waste is handled appropriately and safely. HIC 6A. Then fifth chapter, sixth standard, and A objective element. The scope of surveillance incorporates tracking and analyzing of infection risk, rates, and trends. HIC 6D. Fifth chapter, sixth standard, D objective element. Surveillance includes monitoring compliance and hand hygiene guidelines. HIC 6F. Fifth chapter, sixth standard, F objective element. Surveillance includes monitoring the effectiveness of housekeeping services. HIC 7B is your fifth chapter, seventh standard, B objective element. Cleaning, packing, disinfection or sterilization, storing, and the issue of items is done as per the written guidance. So this was all about the NABH standards core objective elements of the first five chapters. I hope you really like this video. Please do not forget to like, share, subscribe my channel, and you can also follow my Instagram account, Healthcare for You Forever. You can scan the QR code which is given on the slide and which can help you to get to my Instagram account. I hope you are all healthy, and goodbye. Stay safe. Thank you.